I just want to go back. So in the first wave, so when COVID first came, we were really fortunate that we did not see many children. I mean, I think I can count on one hand the number of kids that we had with that were COVID positive in the hospital because of COVID in that first wave. Now, this second wave that started this summer and into this fall, we definitely have seen increases. Dr. Taylor said on a couple of given days, we were the children's hospital with the largest number. It also has increased because we did start screening all patients coming into Children's Hospital at the time of admission, because we needed to know. We had a lot of asymptomatic children who would develop symptoms after they got here. They came in for something else, and so we were then running the risk of having staff and people exposed. So that probably increased our numbers a little bit. I would say we have seen all ages with COVID for sure. I would say that we divide it sort of greater than 12 years old and less than 12 years old because we're looking at vaccination rates. I would say we've seen more children in the greater than 12-year-old age, so it probably is a little more prevalent in the teenagers. Definitely the sicker kids in general have been those older kids, and they're usually kids that have other health issues. But we have seen newborns. We've seen newborns that were born to mothers who were COVID positive in the hospital and all the way through. I think that also in this question was how many of them are unvaccinated versus vaccinated, and essentially they have all been unvaccinated. I think we've had one or two show up on our daily census that maybe had their first vaccine, but remembering that half the patients, less than half that we see are under 12, so don't have the option for the vaccine, and then everyone else that we have had with maybe the one or two rare exceptions have been unvaccinated as well. So we have definitely seen that in the adult population as well, but definitely in pediatrics.
Thank you, Dr. Stephenson. Mm-hmm. The next question have you seen a form of long haulers in children? Dr. Stephenson?
Yeah. So that's a great question. And some of that still remains to be seen, because again, remembering that in the first wave, children really were not the primary source of COVID, and definitely not in the hospital. This wave, the question is, are we going to see some of that? Now, the good news is that a lot of the long haulers in the adult population that's due to the fact that they have a lot of underlying disease, and it just exacerbates some of their underlying disease. And thankfully, kids are generally fairly healthy. I would say that we've had a few, and we've had questions from our community pediatricians about what should we be doing with these kids that maybe seem to have a longer course. Most of what we're seeing is just prolonged fatigue and just really kind of not bouncing all the way back. I would liken it almost to a mono kind of thing. Kids go down and they stay down for a few weeks, and so thankfully it hasn't been a whole lot more than that. I'd say I did reach out to our pulmonologist. They've maybe seen a couple asthmatics that had COVID that are requiring a little bit more step up in their asthma therapy, but I do think we still are waiting to see what's going to happen as we come out of this wave that we've just been in. Would you agree, Dr. Burch? Mm-hmm.
Yes, I agree with that 100%.
The next question, are you seeing more children and teens with mental health crises, and do you attribute this to the isolation of children being out of school last year? So unequivocally, are we not seeing more children with mental health crises? I think at one time, 23 of the 46 kids that were on the hospital service all had mental health issues at one point during the last several months. Nationally, they're reporting that. We're seeing it in the children who are admitted for other diseases. We follow that every morning with suicide precautions. And unfortunately, there seems to always be a child that's on that list, or more, sometimes 3 or 4, that have expressed suicide ideation or concern. And we're also seeing a lot more child abuse. That's being reported nationally, and we're seeing that as well. And then we think those are, yes, results of the isolation that we've all felt, and families being more stressed. I think the physicians in the private community are reporting to us that they're seeing and being overwhelmed with the number of children with depression, anxiety, and other mental health disorders. So yes, that is a consequence of the epidemic, and something we're definitely seeing. Drs. Burch and Stephenson, anything y'all wish to add to that?
I think the other thing I would add to that is that this transition in and out of virtual schooling has led to some difficulties in those kids that have attentional problems as well. And so kind of on and off meds and trying to find the right, sort of the right program for them to be able to be successful. So as they've gone, some kids did great with virtual school because it was easier for them to focus, and now they're back in person school and they're struggling because of all the distractions, and some it was the exact opposite. And as Dr. Taylor said, I think the stressors on the family just have trickled down to the kids as well, and that has impacted them. The private offices are seeing lots and lots of children with primary complaints related to mental health, anxiety, depression, attention problems.
The next question I'm going to pitch to both Drs. Burch and Stephenson. Doctors, nurses, and healthcare workers have been under such pressure and working longer hours. How are you holding up? How can the community help? So Dr. Burch, you want to go first, and then Dr. Stephenson?
Yeah, so we're tired. I'm going to be real honest. We're tired. You are seeing me with no makeup on. I have had no makeup on for almost 2 years, except for TV. We're struggling, and I think that this second wave of COVID, pediatrics has struggled a little bit more as far as it hitting us more as being in the hospital. But the interesting thing as well is that not only was COVID bigger in the pediatric population as far as numbers that we were seeing this second go around, but we're seeing way more bacterial infections, higher acuity type infections, and other diseases as well that are in the hospital. So what Dr. Taylor alluded to is, our PICU has been full now for 2 months, over 2 months. We are seeing larger amount of hospitalizations with a higher acuity, which puts stress on all of us, the nurses, the doctors, the respiratory therapists, all those kind of things. So we're doing the best that we can. The good news is that most people in pediatrics love their job and are happy to be in pediatrics. And so that makes things a little bit better. Also, for the most part, pediatric hospital is a nice place to work, and we're usually really happy people anyway. So that does help, but we're tired. And I'm praying to see the end of the tunnel for COVID soon.
Dr. Stephenson?
Yep. So I would echo what Dr. Burch said. I will tell you that Dr. Burch is extremely tired because she has been a raging force to help us care for the COVID kids. So she deserves to be extra tired. The second part of that question was, what can the community do to help? I think things like this, where people are interested in knowing more about what's going on, is nice to make sure that the community knows what's happening inside the walls of the hospital. I think that helping us promote vaccination, not just for COVID, but flu, because we're all extremely worried about what's going to happen this winter if we have a bad flu season. So helping us promote vaccination, helping to promote masking, that's been such an issue, but really encouraging wearing masks and following the mask mandates, because we do know that helps, and certainly, and then, the community has been great. We've had lots of meals and things like that delivered here, and those things do help. They're nice. I think everybody likes to have a little moment to gather to grab a box lunch or something like that. But really, I think just supporting what's going on here, being a voice for Children's Hospital, which all of you on this call always are, and supporting the efforts we have towards the vaccinations and things is the best thing you can do.
And you've heard from both Katie and AK, and that both of them are superstars and have led their teams and worked extremely hard. But I can tell you, we do something called safety rounds, and we've been doing that for I don't know how long. And despite the wonderful spirit that's in our people, they are tired. And you know, they have families, they have people who have been affected by COVID, but yet they keep showing up, taking care of other people's kids. But they are tired, but they're not going to walk away because of how much they love the kids. And so they're often doing that at their own personal well-being and sacrifice. It's evident that we've had nurses, not so much again in children's, but across the board, nurses are leaving the profession, not only nationally, but locally. And we're having other people. So Dr. Stephenson outlined many of the things you can do, but I'm going to add two things to that. One is a simple thank you. If you see someone who you know works at children's or you're at church with them, go just thank them. Sometimes just that will make them get through the next day. The second thing she mentioned is messaging. People do not realize what's happening here. People do not understand what's been happening here for the last 3 months. We put out a statewide thing to everybody, but it's also focused on COVID. I don't think the people are seeing that our capacity is over 100% every day in the PICU. We've been that way for 12 weeks. We've never done that more than 3 or 4 nights in a row, and I've been here for 35 years. And that strains everybody. Katie's team is taking care of kids on the floor that normally would be in the PII. That means nurses are doing things and having to learn new tricks. That means respiratory therapists are having to do more. That means AK is doing more. AK, you know, she works all the time. She called me at 9:30 last night because of something that needed to be fixed. And so this isn't meant to sad like, oh, woe is me. That's not who we said. You heard what AK and Katie and I both said. This is our 9/11. We're stepping up, trying to do it in the tradition of how great those people were. But thank yous and messaging. People need to know. I'm still amazed. I get a few emails, people challenging vaccination. And they just say, well, it doesn't affect kids. You don't really matter. And I said, well, what about, well, we'll get more into that in a little bit because we got a lot to go on. So I'm going to shut up, but thank you for all you do. So Dr. Burch, you're up. We want to ask about the variants. Should we be concerned about Lambda and Mu?
So right now, the easy answer is not really. You know, South Carolina hasn't seen Mu or Lambda. It's kind of burned its way out. Really, the two top variants are the Alpha, which is the original strain, and then the one that we're seeing now. So, which is the Delta. And so, regardless, you know, it doesn't change what we need to be doing, which we all know is making sure that we're vaccinated as possible and using hand hygiene, using our mask when we need to, those kind of things. So, but we're always on the lookout. And DHEC does a really good job about monitoring those variants. There actually is a great website part on DHEC, and you can go and kind of Google COVID. This is what I do, COVID variants DHEC, and it'll bring you up to the right web page. You can look at it there. But that's also a great place to look at the Miss-C cases across South Carolina and how those are broken up. And remember, when you're looking at that, number one, Midlands is the largest number of Miss-C cases, but we also covered the PD quite a bit. And the way that DHEC does their breakups, Orangeburg is actually the Low Country, and we service Orangeburg. So we have definitely seen the majority of the Miss-C cases.
So, AK, if you get this one right, I'm going to let you buy my lottery ticket. Flu season's upon us. Any predictions for this year?
Yeah, so everybody wants to know what the flu is what's gonna happen with the flu. You know, I suspect that it'll be a little bit bigger than what it was yesterday. Flu was essentially non-existent, or last year, non-existent last year. A big part of that is I have two reasons. Number one, everybody was wearing masks at the time, right? And so wearing the masks helps not spread influenza. But I also have a theory that there's only one big virus that can circulate at one time, right? That's why RSV showed up in spring when COVID numbers kind of went down. And so so it'll be interesting to see what happens with influenza. COVID numbers are kind of going down. So it might be a regular flu year for us. Regardless of that, that's why it's so important to make sure we're prepared for the flu season, and doing that by getting our influenza shots is the best way that we can prepare ourselves. And the good news, at least with influenza, is that anybody 6 months and older can get vaccinated for that, which is a little bit different than COVID.
Thank you. So we're hitting a lot of vaccine related questions. So now we're going to mainly call on Dr. Burch until we get to the political question, and then I'll take that one. So the first one we have is, of the children 12 and older who have been vaccinated, is there any evidence? We didn't quite understand the question, but we think, is there any evidence that is more protective than the risk of COVID? Meaning taking the vaccine and risk of the disease.
So I think that when you look at vaccination in the pediatric population, the biggest thing that has come out that people worry about is the risk of myocarditis, which is inflammation of the heart muscle. And that was seen in some adolescent and young adult males, where there was some inflammation of the heart muscle. It was very transient, meaning that it lasted a couple of days. Most of the time it did not require hospitalization, and if anything, most of the time it was treated with just regular ibuprofen or other NSAIDs. That being said, and Dr. Stephenson can definitely chime in on this, the myocarditis that we see in patients with MIS-C is 10 times worse than any type of myocarditis that you can see from the vaccine. I have a kid upstairs in the PICU right now who is sick with MIS-C, and she was not vaccinated. And part of that, one of the biggest parts of MIS-C is that myocarditis part. And so vaccines help prevent MIS-C, because you have to get the virus first to be able to get the after effects of the virus, which causes MIS-C. So hands down, you are going to be much better off by getting your kids vaccinated against COVID than protecting from side effects and problems that are associated with COVID than any kind of side effects that would be associated with the actual vaccine itself.
Yeah, and I'm just going to jump on into that a little bit more too, because as Dr. Burch said, there's only been one child of my knowledge in the whole state of South Carolina admitted for vaccine related, and that was when the first myocarditis came out, and we didn't know what to do with it. But since then, I'm not aware of any child being admitted for a vaccine related issue. Also, think about it, there have been over 500 deaths of children from COVID. I don't know, and Dr. Burch can comment, less than a handful worldwide or in the country from the vaccine that's been proven. So the risk of death is far greater. And then let's talk about hospital admissions. I mean, the number of children who have been admitted to the hospital, I mean, that's not insignificant, and versus not with the vaccine. So there's so much safety in this vaccine and benefit versus the risk of this MIS-C that Dr. Burch has spoken about, risk of death, hospital admissions, and we talked about the mental health effects and so many other things. So, AK, did I say anything wrong?
No, you didn't say anything wrong. That's great.
All right, so let's go on to the next one. Does COVID-19 affect fertility or puberty?
So this is a hot topic as well. I've heard many OBGYN and endocrinologists kind of talk about this. No, it does not affect fertility. It does not affect puberty. But unfortunately, because this misinformation has been put out there, there are many pregnant women or women who are trying to get pregnant who are not vaccinated. And unfortunately, unfortunately, being pregnant is one of those risk factors that increases significantly your chance of morbidity or mortality from COVID. And not only that, also it's the same thing for influenza as well, right? So they kind of go hand in hand together. This is a really, really, really important topic, and it's something that I hope that you learn and can spread that good information that it really does not affect either one of those two things. And if you know any women who are trying to get pregnant or who are pregnant, it is imperative, really honestly, that they get their COVID and their influenza vaccines. I can't tell you, I mean, sad stories basically of women who are completely normal 25-year-old women who are pregnant who either lose their lives, or currently there's one in the hospital who's walking around on a ventilator. And she can't, she's waiting to get a lung transplant.
And we, y'all had, and you, I know you've seen it on the national news, and Dr. Burch mentioned it, but at one point we had 6 women who were pregnant, who had gone into preterm labor, who were on vents or other things, and their babies were delivering prematurely, or we were trying to prevent that. And some of those women did not have good outcomes. So if you're pregnant, even if you've had COVID, you are not protected without this vaccine. And the risk of premature labor and death is so very high. Mm-hmm. And so if you can do anything, encourage your loved ones, if they're pregnant or thinking about it, to get the vaccine.
And you know, we don't want to be scaring you, obviously, right? And so the things that I say, it just is really important that you go out there and get it, right? I mean, I think that that's the key. And try not to scare, you know, have the scare tactic of forcing you to go get the vaccine. It's really more importantly, just making sure that we give you good information so you can make that decision for yourself based upon the data.
Thank you. Next, is there a waiting period after you have COVID to get vaccinated? And if age appropriate, how long before they can get vaccinated?
So people ask me this all the time. It used to be in the very beginning that if you had COVID, you needed to wait 3 months before you got your vaccine. And essentially the reason why is because we didn't have enough vaccine. And so you would be, you know, protected for the first couple of months, so you could wait a little bit longer to get the vaccine. So it gave the industry time enough to make enough vaccines for everyone. But in reality, it does not matter. The only requirement that you have to have after COVID infection is that you have to be off of your isolation before you can go get your either first series or your second booster, or even your third booster of the vaccine if you qualify for that. So remember that that does change the time that you're on isolation just really quickly. If you're immunocompromised in any way, that's 20 days instead of 10 days. So,
thank you. So the next question is, do you think children 5 to 11 will be getting the vaccine by Thanksgiving? Many parents don't want to be first in line, but wait and see. Your thoughts?
So yes, I think that kids will be able to get the vaccine by by Thanksgiving. I actually am hoping by Halloween or the first part of November. And so I know that there are some who want to wait and see kind of approach. I'm going to tell you that this vaccine has been given to a lot of people, both adults, elderly, younger people, you know, grade 12 and above. And then even in the studies of looking at 5 to 11, it is safe. You know, it's just a matter of formality really for the ACIP, which is the governing body of vaccines, and the CDC to go ahead and approve this in the FDA. So in my opinion, I wouldn't be in that category of waiting to see what happens. The other really good thing to remember about this is if you get your child vaccinated and they've gotten 2 shots and it is 2 weeks after your second shot, it doesn't matter if they're exposed or not in school. They don't have to come home. And that's a really, really, really big deal, especially for working parents, trying to figure out who's going to take care of their kid while they stay home. Plus, you're keeping the kids in school. That's where they need to be. We've already addressed the mental, the mental illness part of being at a school, not being able to get good instruction. A lot of kids do struggle at home with virtual learning. So all around, it just benefits kids and us all really, to get your 5 and above, when it's available, your children vaccinated.
Next question is, I work in politics and hear a lot from people who do not think the vaccine is safe. And one of the major concerns is the use of mRNA with the COVID vaccine. They would like to hear about how that is. And so I want to comment, and Dr. Burch can jump in. The mRNA technology has been around for over 30 to 40 years. This is not new. And that's where a lot of people are so misinformed. It started back in 1986 or so. And the reason it didn't become widespread because of the expense, but they had it ready to go in different diseases. And pharma just didn't want to spend the dollars to make it come to production. And so the technology is not new. And the technology has been tested in mice and other things. The other thing is to reassure you about the technology is that unlike most vaccines, think about it, they were tested in children first. So children were exposed to the risk first. These vaccines have been tested in the adults first and have been given to billions of people. If you look at how most vaccines evolve, they evolve in the clinical trials are a few hundred, maybe 1,000. These have had 30 to 50,000 people in their clinical trials and didn't have side effects. Then they were rolled out to the adults. The reason these vaccines seemed to come out of nowhere is all the pharma companies and other research people were primed to do this because this technology had been there and that they had been preparing for a type of infection where mass use would cover their investment costs. The governments of the world kind of took that away from them and said, here's money, we'll help you produce these vaccines. Don't worry about producing something and then when you get it to market, it doesn't stay stable or you have to produce something different. The other thing about safety of vaccines, think about it. Most side effects of all vaccines that we've ever used have shown up pretty quickly in 2 to 3 months. And it did some in these vaccines. A lot of people have heard about the clots. You've heard about the myocarditis. And those things have been identified quickly, looked at. And since the use of vaccines, the governments and the World Health Organization and everybody has developed better processes of monitoring. So things like the myocarditis was known quicker and faster. Things like the clots that occurred with the J&J. So this technology is not new. The trials that were used to put it to use were much, much larger. The technology is a safer one because we're not using attenuated or weakened viruses and putting that into you. And this is going to be the new technology. This might give us a chance to actually have a flu vaccine that actually works all the time, because right now we have to guess the strains. So we do the best guess based on what happened in Australia or wherever, and we miss sometimes. So we're going to be able to actually produce a flu vaccine or one against malaria or TB or HIV that will transform the world and also be used in other diseases like cancer. Okay, I get it wrong. Anything you want to add about how the technology came about and why mRNA is safe?
Yeah, no, that's perfect. I also want you to know, people get misinformed. They say messenger RNA virus or vaccines will change your DNA. I don't know if you hit on that. That absolutely is not true. Okay. So the way that messenger RNA works, it doesn't even get inside the nucleus where your DNA is, right? It stays outside of the nucleus. It does not get anywhere close to your DNA. All it is a piece of information that your body uses to make a protein. And that protein, when it's put out into cells, your antibodies can make, your body can make an antibody towards that protein. So there has absolutely nothing to do with changing your genetic material.
Thank you. Next question's for you again, AK. What do you anticipate about the availability once it's approved? You kind of touched on that.
Yeah, it's going to be in high demand. I mean, high amounts, right? We have a lot of vaccine that actually we're having to get rid of because nobody is necessarily taking it and getting vaccinated now. It's the exact same vaccine, it's just a smaller dose. So we have plenty of vaccine for kids 5 to 11. That's not going to be an issue at all. Really, it's just waiting on the formality for the governing bodies to say, yes, the data is there, that it's safe, that we can roll it out. And then I would venture to say that every place that you can get a vaccine will be ready to go the next day.
Yeah, and I was just going to add to that. So it will be readily, the actual vaccine product will be readily available. I know that our community pediatricians are a little bit concerned about everybody coming in and all on the first day and wanting to get vaccinated and being able to handle that volume in their offices. But I think almost all of our practices are providing the COVID vaccine right now to the 12 and above. Prisma Health, our drive up vaccine that we have here over at 12 Medical Park is going to be offering it for children when it's available. And in fact, we'll probably adjust the hours some. So right now we just have vaccines in the morning, but we know that won't be as good for the school age children. So we will be probably opening some night hours and possibly even some weekends. Yeah. So hopefully that will help sort of make sure it's available when people are able to get it, when they want it, and not be held up or overrun the pediatric practices in town, family practices in town. So
I would like to make just a little bit of a correction of my statement. So I have my amazing partner over here, Rob Daniels, who's sitting right next to me, who is a pediatric ID pharmacist. It is a different concentration, so we can't use the one that we had. The volume is different, but we will have it and be ready to go.
Thank you, AK. So the last question, and I'll let each one of us kind of give our own opinion. Will the COVID vaccine be required for children in order to attend school just as other vaccines are? So who wants to go first? I'll go last since I'm old and gonna give the last opinion. AK, you want to go first?
Yeah, I'll go. So this is going to be very equal somewhat to influenza, seasonal influenza that we have now. Once you have a pandemic strain of a new virus, eventually enough people will get immunity to it that it will mutate a little bit every year, but it will not be to the point that we've had the last 2 years. So as we have a seasonal influenza shot every year, that is not mandatory as far as school attendance is concerned. It is recommended, but not mandatory. I suspect that the COVID vaccine will play in that same role as the influenza vaccine, but there probably will be a yearly COVID vaccine if I had to guess about it in the future.
Thanks. Okay, Katie, you want to say
I would say the exact same thing. I think we're far from it becoming mandatory. I think time will tell what comes of it, but I agree with Dr. Burch that most likely it's going to be like the flu vaccine, and what we can do, we may not mandate it, but we can absolutely encourage it.
I would agree with them, and I would add another factor. This has been the only vaccine that I recollect in my lifetime that was so politicized. And so I don't think, for the reasons Dr. Burch primarily outlined, is most of us through infection vaccination will do okay. that we will be all right. But I think politically, it won't happen. If in the old days, people signed their children up for the polio vaccine. In the old days, people were clamoring to get their children into trials. People wanted, in the old days, we used to have the chicken pox parties, right? But we realized that getting the varicella vaccine kept you out of the hospital and kept you from getting rare infections and complications. But I think due to the seasonal nature of this, that it will not probably be made mandatory. But then I think the other thing that would affect it would be how this disease has been politicized instead of being approached as a public health issue.